The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Alicia wants to know, do you think the ABA is a good thing? My son is on the waiting list. We need more help with potty training, feeding, and communication. He is nonverbal 11. I am almost 41, and we need more independence.
Yes. What were the requests? Potty training, communication, and what was the middle one?
Feeding.
Eating. Okay, feeding.
Feeding, yeah.
Yes. So yes, ABA is a fantastic thing. ABA is a teaching technique, and it is wonderful when it's done right. So, and when it's done right, you see progress. Now, I do want to kind of step back and say, just like anything else, when you first start something that is teaching you new things and is demanding, children will tend to want to try to avoid it because it's hard. But this is the only way that they learn rapidly. And as they realize, oh, this is going to be fun, I'm learning and I'm getting lots of reward, then they jump into it, and then it becomes like I always refer to ABA, good ABA, as a kind of the child's mode of communication. It just becomes their world, and they love it because they're able to communicate with all the folks that they work with. They're having fun, they're learning, they're moving forward. And so, yes, these are things that are very good. Now, it's also extremely important for your child at this age to have the skills that he's lacking, right? So toilet training at 10, I mean, that's a very, very important thing, right? It'll give him a great deal of independence if he's able to go to the bathroom by himself. So that's one. And yes, ABA programs do teach that. And communication, of course, nonverbal or verbal, it doesn't matter. We're looking at teaching your child ways to communicate his needs, ways to communicate what's going on in the world, how he feels, what does he see, what does he want. All of those things, they can be through OG devices, through sign, through picture exchange system communication, or vocal communication. And think about it, when your child learns communication, they do become not just more independent, but happier, because now they're able to express their needs to the world. And then they become more part of the world as opposed to being isolated and not knowing at all how to communicate with anyone. And then the third thing was feeding, which is so important because not only do our kids become nutritionally deficient, this just becomes a nightmare over time. And yes, a lot of ABA programs have programs for feeding, very specific programs for feeding, which are very, very successful. In fact, feeding programs are one of the most successful programs in ABA. And through feeding, through these programs, an ABA specialist or a BCBA will teach your child how to broaden their diet so that they're eating different things, how to eat, appropriate amounts at each meal, how to tolerate different textures, all kinds of things. So I think it's really important that you do try to get into a program, an ABA program, and that you very specifically ask them to focus on these three things. At your child's age, you are going to be receiving what's called a focused program, and you've already identified three very important areas that need to be focused on. Now, depending on your child's challenging behaviors, whoever you talk to, a BCBA might say, oh, sure, I'm happy to do toilet training, but before I do it, I need to do a little bit of work on compliance, because obviously you don't want a child who is, let's say, aggressive. Trying to put them through toilet training just doesn't work. So there might be some prerequisite work that needs to happen, but they're going to do all of it. And I think it's vital for your child at this point.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.